Easter Seals, YMCA, even Shelter in Arms. There are various child care providers that can actually provide that services so that we can extend to those areas that need us the most. You know, 1 out of 4 children that are in rural communities are being serviced right now by Head Start. So we are a collective community when it comes to that. Although we're, you know, isolated as independent providers, we also still stand collaboratively on the Head Start standards, what they provide, having those wraparound services. We can all speak on those actual entities that are part of the program.
So your efforts, all of your efforts on Capitol Hill with members on both sides of the aisle helps to educate folks on how these cuts would affect people in their district. So what I said earlier, 435 congressional districts across the country being impacted is your testimony. Yeah. Thank you.
My name is Alejandra Martinez. I'm the Director of Family Services with Sheltering Arms. And we've been around from 1888, and a lot of what we do kind of echoes our fellow counterparts with Easter Seals and YMCA. But I wanted to talk to you about my team and what we do. So I oversee all of the family programming that takes place across our 11 centers. And we serve around 2,000 families. And what the family support coaches do is they meet with families, and from the jump that they are enrolled, we figure out their needs assessment. And we do this twice a year. And from that needs assessment, we figure out what goals they have and what referrals they need. And so we've done that, and we're tracking the data, and what has happened in the last year is nothing short of catastrophic. What is happening? And everybody is just at a rim of, I don't know what else to do. And yes, we're talking about families that are the absolute neediest of the neediest. And I don't say that, you know, in a disparaging way, it's just fact. But I'm also saying that for families who are working families, families that have decent income, families that have 2 parents that have education, and we are scrambling to meet those needs, to find more partners, and those partners are kind of like, oh my gosh. And so I just wanted to paint that picture because yes, Head Start speaks to the needs of our families' health and safety, making sure that there are you know, a medical home, that they have a dental home, that they can get there, that they have the transportation. But without programs like Head Start, really and truly, they can't do the bare minimum. We're keeping them employed, we're keeping them sane. Our mental health referrals are just, it's just overwhelming, these numbers that are coming through. And so, you know, I know this is across the board, and I know this is across the nation, but my message to you is just, this is a critical time. And, you know, at Sheltering Arms, we have had the privilege of taking parents, and now we're moving into an advocacy role. We've always wanted parents to be leaders, right? That is one of the performance standards that Head Start says. We want to have parents be leaders in the community, in their home, and advocate. And now it's like, oh, this is what we've been preparing for, and we didn't know it. We had the honor of taking families to Washington, D.C. We were able to meet with one of your staffers, with Senator Warnock, with Senator Ossoff, and just tell our stories of how we need Medicaid, how we have children that are being diagnosed with autism, how we have families that need to work and without this program. And so, you know, we could take that and we can multiply that across every single county, and it still could not impress you enough of how real this, you know, epidemic is. And just thank you for your service, thank you for this opportunity, and I just wish you all the energy and optimism as you fight the good fight on our children and families' behalf. So thank you.
Thank you.